Sickle cell disease affects blood cells, leading to pain, infections, frequent hospital visits, and many more complications. For some patients, the bone marrow transplant offers a curative treatment option. Bone marrow is a soft tissue inside bones where blood cells are made. In sickle cell disease, the marrow makes abnormal sickle-shaped red blood cells. A bone marrow transplant replaces this with healthy red blood cell production. The first step in bone marrow transplant is finding a suitable donor. A brother or sister who is a close tissue match is often the best donor, whether they are completely healthy or have sickle cell trait, as long as they do not have sickle cell disease. Testing is simple and painless. If no sibling match is found, other donor options may be explored. Both the patient and donor undergo careful evaluation. This ensures the donor is healthy and the patient is strong enough to safely receive the bone marrow transplant process. During bone marrow transplant process, patient is admitted to the hospital and receives chemotherapy and immune weakening medicines. These treatments remove diseased bone marrow and create space for healthy donor cells. On transplant day, healthy bone marrow cells are given through a special catheter into the blood, just like a blood transfusion. These cells travel to the bone marrow and begin rebuilding healthy blood cells. The medicine can cause temporary side effects such as infections, nausea, vomiting, mouth sores, hair loss, or tiredness. Patient's liver, kidney, and other organs are closely monitored during this time. Patient receives frequent red blood cells and platelet transfusions till new cells are ready. The patient's clinical status is closely monitored and is treated by the special transplant team. The patient stays in the hospital for 4 to 6 weeks or longer based on their clinical status. As new cells grow, patient's clinical status improves. Doctor watch closely for graft versus host disease. Patients take immune suppressive medicines to help donor cells settle and prevent this graft versus host disease. After discharge, patients are seen frequently at first to closely monitor recovery and the development of any complications, which can be treated appropriately. As healing continues, clinic visits become less frequent with careful follow-up for up to 1 year or longer based on patient's clinical status. After that, yearly visits continue to monitor for any late effects and to support long-term health as the patient remains cured of sickle cell disease.